one time I was leaving my house early in the morning, dropping my son to school, and I sort of was not feeling too well. And my driver says, maybe you should go see a doctor. And I was looking at my busy schedule. I was okay. I was just feeling fatigued, right? So what I did was, when I was driving, when driver was driving me to taking us to drop my son and me in school. This was sometime in 2019, or sometime in 2020. I sort of figured out, okay, look, why don't I just call my doctor? So I've got a personal physician, called him, he was not available. I then connected, I went to WhatsApp, I sent him a message, I'm not the way I'm feeling. And he then proceeded to tell me, look, why don't you do some tests? And then I told him, okay, yes, I can do the test. He gives me a list of tests. The next thing he tells me, he sends me a prescription pad with the lab test to do. He tells me, look, I know a lab that can come to your office to do the lab tests. So by the time I dropped my son in school and I go to the office, the lab is waiting for me. So the guy was there to collect blood samples. He knew what to do. The lab, he came with a lab collection form. He took my blood work. I paid using M-Pesa, which is what a mobile payment platform. I also paid my doctor, and then on top of that, I continued doing my work as normal, because it's not like I was sick. I was just feeling fatigued. Subsequently, 4 hours later, my doctor was able to call me back and say, look, I've received your results, Mike. I think you need to get some vitamins, whatever else. He gave me my treatment regime. And then I paid. Then what happened? He sent me the prescription of drugs. I sent them to a pharmacy I knew, and the pharmacy was able to dispatch the medicine using like an Uber motorcycle delivery service. They delivered to my office, and voila, I took my drugs and continued. Then subsequently, 3 weeks later, similar thing happened. I'm driving my son to school and he's not well. And he sort of throws up in the car, and I do the whole process again and again. And the same procedure of getting a doctor, getting everything. I thought to myself that in my case, most likely I would not, because of the inconvenience of trying to do those lab tests and have been in traffic, I would maybe never have left my office. I would have maybe just told myself, okay, I'm sure I'll feel better, but I'll do this another time. But in my son's case, it was urgent. I had a meeting in the office. I needed him to sit on my couch as I got the doctors to check up on him. We did a tele-consult with the doctor, not using normal WhatsApp, using normal video. The same procedure happened. Lab tests were done. He slept on the couch a bit as I had my meeting. 4 hours later, his medicine was delivered. I dispatched him home, right? And that would have taken me a whole morning to go to the hospital, having to queue, wait for a very long time to try and get a booking, and just the inconvenience of trying to be on the line, to queue, waiting for the doctor, then waiting for the whole process. For me, I thought, wow, I realized that everything was in place. The provider's ecosystem was in place. The FinTech platforms were in place. What was required was a technology-driven platform to put everything together, connect the doctors, the labs, patient records, payment platforms. I just figured out, look, this is what is required. And I said, the reason why we don't seek healthcare is because it's complicated.